Hi everybody, welcome to the co-videos. This is the April of 16th. This is the 16th of April, and this is Dr. Kestler from Lorain County Community College. I forgot who I was here for a second. Okay, today is my temperature is 96.8, which is 36 degrees Celsius. I want to start by just mentioning that I want to say something good to you all. You're doing a great job. You are making a difference, and that's a very important thing. If you think you're too small to make a difference, you're wrong. You are making a difference. And I've got this quote up here from the Dalai Lama that says, "If you think you're too small to make a difference, try sleeping with a mosquito. They make a real big difference in your sleeping." There's some good stuff to talk about today. First of all, I want to also give a lot of credit to people who've been working hard. These are agencies that when they do their job, you don't know they're going on. And so, we have Médecins Sans Frontières, that's my fake French accent, which means Doctors Without Borders. That is an organization that does a lot of good work and goes into places where there's lots of diseases and outbreaks. National Institutes of Health, Centers for Disease Control, World Health Organization. All of these agencies are keeping you safe, even when they're not helping in this country. You might say, Doctors Without Borders, they never came to my town, but yet they are keeping you safe by keeping other people. Infectious disease do not respect borders, and they can easily jump over borders without problems. So we should not have borders with respect to infectious disease, and that's the way they operate. So these are organizations that do a tremendous job, and their job will need to continue, most definitely, as time goes on. I think we have seen outbreaks of diseases in the past, and they will continue. First of all, let me tell you about the job that we're doing in Ohio. The governor is very upbeat today. I noticed the governor's talk today is very upbeat, and I think that we are moving towards a different operating procedure coming really soon. One of the great things that my wife and I absolutely had to go to the store today, so we went to the store today, and I will tell you that there were some good things in the stores. And they were strictly enforcing social distancing, and I went with my mask, and she went with hers, and we decontaminated the food as it came out of the bag, and so these are all good efforts that people are making, and we should continue to it. You'll notice that these are the data for today, which really means yesterday, by the way. This is always like a day in behind. The number of deaths, yesterday's deaths, as well as yesterday's case counts. I think you can see that even though the gray shaded area is preliminary, it looks like things are starting to level off. It looks like things are starting to get good. What does that mean? Does that mean that we can stop tomorrow and go back to business as usual? No, not at all. In fact, things are going to be different, even when the governor relaxes and the states relax their social distancing. Social distancing, let's say, is probably going to go on for quite some time. We will probably be wearing masks. And I just want to impress upon you why we are going to. What is the deal here? Well, on the right-hand side of this slide, you can see that there are 2 million cases of coronavirus. There's probably much more than that, but those are the ones we absolutely know about. We know that there are 2 million cases of coronavirus right now. We have 142,000 lost lives as a result of this worldwide. And that number is a little bit more solid. I know there are people quibbling about who's being counted as a dead and did they really have it? Did we really test? A lot of times we just rule it out, and by looking at if an entire family is sick with the virus and one of the members dies, we can assume it was probably the virus without testing. We are still without enough tests that we need to move out of this. We absolutely have to get the tests rolling. We have to get them rolling in a more efficient fashion, and we need an antibody test. I think we've already kind of talked about that one already before we move out. And then the bottom number there is 500,000, 500,000 people who have recovered. Those are 500,000 people that we believe are for sure immune. On the left-hand side, I just put the world population on there, and I'm sure it changes like even by the second. But if you take the 2 million cases and you divide it by the world population, which is 7.8 billion people, and then, well, that becomes less than 0.3%. In other words, that are COVID positive. In other words, there's 97% still possibly who are able to be infected, who are able to be exposed. So that's a big deal, unless we can completely eliminate the virus. Of course, this virus only used to be in animals, and if we could return to that, if we could sequester every human who was infected, that would work. And that would be something that we could do. But, you know, that requires you to have a lot of trust in your fellow humans. And again, we all can make a difference, but everybody has to work together towards this. So going forward, you're going to have to socially distance, isolate yourself, quarantine yourself if you become sick with this in the future, and we know that. We'll quarantine you for 2 weeks, and then we'll have you look for your contacts. Unless there is one way out where we don't have to do such draconian measures, and that is a vaccine. And I'm a little bit encouraged by the fact that recently some researchers, and I'm trying to think where these folks were. I think they were in the Scripps Institute out in La Jolla in San Diego. And I will tell you that the Scripps Institute is a beautiful place. One of my former students and employees, Janelle Sokowitz, did a postdoctoral experience out there, fellowship out there. Sorry, couldn't think of the word. And it overlooks the ocean. It's a beautiful institute. At any rate, these guys made X-ray crystals of what might be a very important part of an antibody bound to the spike protein, or the viral receptor binding protein. And I'm just going to show you a little piece of that on the next page. And what you can see in the orange and the yellow is the human antibody. This is from someone who has recovered. And that human antibody is grabbing a hold of the spike protein, and this might hold a key to a vaccine. The reason it might be, yesterday you heard me talk a lot about genetic variation in the coronavirus family, in COVID-19 family. The reason that we're excited about this particular finding, and again, this is just a preliminary kind of a thing, is that this particular epitope, this particular region of the spike protein is shared between the two COVID viruses, the SARS-1 and SARS-CoV-2. Both of them have a similar kind of a story, and the hope is that this antibody could potentially make for a vaccine or even make for a treatment. I would like to tell you more about one of the things I'm going to be covering in future episodes is the people who are receiving plasmapheresis or plasma from recovered patients. I don't have a lot of information as respect to the effectiveness of it. I have a lot of anecdotal information, which is great, but I will remember you need a study, because a study is going to tell you not only success but failure. And that is going to become an important kind of thing in determining if this is in fact a good way forward prior to a vaccine. Obviously, a vaccine would be the most useful kind of a thing that we could use right now. All right, I'm going to stop right there and remind you all, Keep up the good work. Individually, you are making a difference. It is worthwhile. It is a sacrifice. It is a shared sacrifice. We are all sacrificing our time, our energy, our money, and efforts, all for a common goal. This is a shared sacrifice among us all. We are all going to share in the victory when we get through this. So I just remind you to all be good to each other, and may you persist like a lentivirus. Thank you.